always liked nursing. I really didn't see myself in any other profession. I truly love nursing. So from school days, I would always look at nurses and wish I could be a nurse. At the end of school, my schooling, in those days you used to write and apply through the Ministry of Health, and nurses who graduated abroad, particularly in England in those days, would put a picture of themselves that they have graduated from whichever hospital. So one day I saw this nurse who lived at Mount Lambert and graduated at King's College Hospital in London. So I had just finished school, so I wrote to the matron of that hospital, not really expecting a reply. And to my surprise, I did get a response. I gave it to my father and he said, okay, well, let us run with it. But my father was no rich man, so I thought, well, that was a very expensive affair and it probably will not come to pass. But however, in those days, the Ministry of Health was on the Princess Building grounds. So the link was there and he took it down to the Princess Building grounds and then they called me in for an interview. I was just about 17 plus and I did go. And whatever correspondence they did in those days, then they said they accepted me as a student in London. So that was the first step into me entering nursing. I did not know England, I knew no one. I was very timid, I was fearful, and I thought it was a thing I tried that I wasn't really prepared for. So I could clearly remember the day. It was a Mother's Day. After the first year of crying to come back home, I really enjoyed nursing, and I didn't see my life, even today, in any other field. I came to Sandy Valley Hospital in May of 1976, and I was posted first at the Accident and Emergency Department. When I first came to the Accident and Emergency Department at Sandy Valley Hospital, I came from England, where in those days everything was, we had all the facilities, we had all the equipment. And when I came home to Sandy Valley Hospital, it was totally different in that we used to have to cut gauze and cotton wool and boil instruments and what have you, very hands-on. We used to wash gloves, everything. So I came from a totally different environment and having to work in the accident and emergency. The people, they came from the rural areas, of course. The staff was limited. We accomplished quite a lot of things with the limited staff that we have. There was good relationship between all levels of staff and the doctors as well. So in terms of the casualty as it is today, yes, we have more staff, a whole lot more staff. Nurses exposed to trauma training and customer service and other programs that will enhance how they work in the department. Things have improved in that everything is sterile now, everything comes pre-packed, and nurses can give the more direct care to the client in the accident and emergency. One of the things we had to work for towards the diamond standard was customer service. We really worked hard on how they treat the client. The equipment, yes, we have to improve in having all the equipment. The environment must be clean to meet a particular standard. But one of the focus I felt was the customer service and how the staff interacted with people. Even if we were deficient in something, that customer service was something that we really had to work on to make people feel comfortable, make them feel that yes, we care, even in an emergency setting. I started off in the accident and emergency, and I worked through the entire hospital. I was nurse in charge of maternity, and I cannot remember the exact year. I worked there for about 8 years in our maternity. I was also the infection control nurse for 3 years, and then I went as nurse in charge of obstetrics. Coming to Sandy Valley Hospital, when I was sent into maternity, I worked first as a registered nurse midwife, and then I worked as a nurse in charge of maternity. Some years now, and yes, I really do have a love for maternity and mother, child, delivery, labor, all aspects of maternity. It is my passion, and even today, even though I'm not assigned to maternity, every day at Sandy Grande Hospital, I walked into maternity. I always go to maternity, look at the mothers, talk to the mothers, talk to new midwives. I have a passion for it. Whether the new nurses coming in have that passion and ready to take up the mantle, I will look at it from a different perspective. In that, in the past, we only had Port of Spain General Hospital and San Fernando Hospital, and that is why so many of the nurses in my era went abroad, because the scope wasn't so wide. So that when you wanted to be a nurse, you truly had to have that passion, because it was a fight to get into a nursing school. Now that it has opened up, you have 3 different training schools, people have different options. So really speaking, a lot of it is, okay, I can get a job. So sometimes, some of the nurses that I meet may not always look as if they have that passion. It's a job and it's an end, means an end, and maybe they will move on into another area or go abroad, and that love may not always seem apparent. Occasionally, yes, I do meet student nurses who, yes, that is what they really want. But if you take it in my perspective, that is all I wanted to be. I wanted to be a nurse, and even if I didn't go abroad, I would have waited until I get in Port of Spain, because that is what I wanted to be. I would say to young nurses coming into this profession, that is not mills and booms. Really speaking, it's a very serious, caring profession, and the emphasis is on caring. It's not about wearing a nice uniform or looking good when you walk the street. It is about putting the patient first and foremost. When you get exposed to the training, it teaches you how to cope with all the hurdles that you would meet. And when you graduate as a nurse, you are committed to a profession and to the client. And it's not about, I cannot come today because I have to go to a party. That is where the test comes in that the patient comes first. And you come to work because the patient, when you get there, the patient is so happy that you come. If you go to work on a Christmas morning, the patient seems so happy. They are so happy that you come out to work. Your family, and this is another area, your family is one that has to understand that this is a career. If you're married, your husband knows who he's marrying. He's marrying a nurse. And even though your family is so important, the patient is foremost. You won't have a salary, you won't have a job if you did not have these patients. And at the end of the day, I'm telling you that you feel so happy that, you know, I'm glad I came to work. That day I saved a patient life because I was there, even though it was a holiday. So, yes, I would tell nurses who are coming in, have that passion, have that caring. Understand that you gain the respect of the public. You have to gain the respect of and the trust. People will say, you know, a nurse is always there. Whatever area you're working, you know, nobody can function without a nurse. All the doctors, all the lab, everybody. But if no nurse is on duty, everything is a standstill. So you have a very important role to play, and you must understand and accept that that is the role that you have chosen. You have chosen, because when you apply to be a student nurse, you could have chosen anything. But the fact that you chose this job, you know from the beginning, and I'm sure in the training they will teach you that it's a demanding job. It really is. So you come in, you give of your very best, you treat the patient with love and care. You must understand that the patient who lies on the bed is someone loved one. And it could be your own mother, and no nurse come out to work a day or whatever, and it's your mother and you feel hurt. So the public too feel hurt. They want to know that we are there for them. I always tell young nurses that you put the client first, you get back blessings in ways that you never expected. And you may never remember that is that you come out on that day and you did something, and God in His infinite wisdom, He blesses you. Either your children get something that you didn't think you could have done or accomplished, and is all the good that you do. But under the ERHA, that is when I moved now from a nurse on the ward to the matron of the hospital. And all what I have learned, what has been taught to me, all the different programs I attended, cemented how I approached this job, and it was a new job to me as the matron of the hospital. I found that I gained in that the people who were now in the ERHA, they were willing to help me, even the senior doctors in those days, like Mr. Hasrana, who's still there. He was like a counselor to me, and I approached this job with hope, let me put it that way. Hope, some knowledge, some fear, and to me, I have had a successful time. I thoroughly enjoyed being the matron of the hospital. It took a lot of my background into how it is not just I wasn't given the direct care, but I was able to use the experience and look at the nurses individually. And I found that as a matron, yes, I see the nurses collectively, but I also had to look at the individual nurse. I talk to them, I see how their career goals, and I see as the matron how I can propel the nurse into the career or the line that she would like to take. I had lots of happy days with working among the staff. I have gained considerably working with the ERHA. I must say that I've had no regrets whatsoever. I have had no regrets. My entire period working with the Ministry of Health, transferring to the ERHA, has been, to me, a happy one, a successful one, and a meaningful one. I became the nursing manager in 2005. And I must say that initially it was not a post that I had even thought I could have been the nursing manager. I was asked at one point, why don't we had a period of time, about 2 years, when we had no matron at all. And the management at that time, they were looking for someone. My colleagues felt that I could do it, and I said, oh no, I can't do it. However, I did eventually applied and went for the interview. I got the post and I accepted it. I had a lot of support from the senior nurses. 1 or 2 of them are still here, and the staff on the whole really made my life easier. The transition from working on the ward, giving the direct care, to being the matron was a bit challenging to begin with, in that you had to be impartial. You had to ensure that the patient get the care. It wasn't a case of I worked on the ward and I was a friend. Or, I had to make decisions, even though sometimes it might be painful to some people. I had to ensure that the nurses got exposure to training and that I supported them in some of the challenges that we encountered. We worked as a team, so I worked with them, they worked alongside me. And I think it has been a good partnership. I would like to see some major changes in health in Trinidad and Tobago. I think we are an oil-rich country, and we are better poised than lots of other countries in the world. For a country like ours, with all the resources that we have, and resources is human and financial as well, I feel that we should be at a better position to deliver care to our clients out there. I see the heartache in some people when we cannot give what we want because we don't have an equipment or something is down for a long month, and we're not short in brain. We're not short in brain. We have a lot of bright people out there who can give the care. So then what is wrong? What is wrong? Why is it that the health care is not meeting, not the rich people, because they can go for their care? It's the man in the street. That when people say they're afraid to come to the hospital because they wait so long for an equipment, or they can't get an MRI, or the X-ray broke down and they wait long, and they haven't got enough of this and enough of that. I would like to see in the health sector that our standards are improved to international level, that people who give in the care are caring, because that is the first part. We must be caring across the board, that we are here to give the client the care, that the executive provide all the workers with the tools, whether it's in radiology, whether it's in kitchen, dietary, whatever, that we have what we need to give the client, that is accessible, because contrary to what people say, they say healthcare is accessible, but sometimes certain secondary and advanced care, you have to come a long way to get it, right? Our renal unit at Sandy Grande Hospital is a perfect example of that, in that our rural patients, they had to go Eric Williams, and even our oncology patients, Port of Spain. We are now attempting to bridge that gap, but the demand is way outweigh the services that we would like to give. So I would like to see nationally people have their healthcare with all the equipment, and I must say that the executive is trying to put open units and hospitals that to meet the demands of the client. I would like to see when people come to a hospital, we have to give them what we have in the environment that they need. The staff is knowledgeable, well-trained, customer service, people feel comfortable, don't feel threatened, and they feel that, yes, we are there to assist them. And sometimes if you want to measure the care, you go as the client, as a health worker. And that is when you see, I took my mother to Eric Williams and we sat on a chair for 15 hours, but nobody knew I was a nurse. We sat on a chair for 15 hours. So, is 2 nurses passing? Richard, why are you sitting there? I said, well, I brought my mother, but I didn't pull around. They tell me wait my turn, and I waited my turn. But this is what happens to the average man. And people don't always have money to go to a private enterprise. And I would like to see waiting time cut down. People don't wait long for an operation. When they come, the operation is postponed because an equipment is down and taking a long time to get it back. I would like to see that. I would like to see them sit in nice environment, air-conditioned room, I really would like to see us go to that level.